Okay, so in this video, I'm going to be discussing potential obstacles, challenges, limitations, and complaints that might arise from utilizing an integrated DMT within the healthcare field. And then I'm also going to discuss how we can overcome these challenges and limitations and possible solutions for them. So to start out, potential challenges, limitations, and complaints, this can come from a multitude of people. It can be medical facilities, people within the medical facilities, patients' families. This can come from a variety of people. And so basically, on this slide, I've broken it into 4 separate categories of the most common challenges, limitations, and complaints that might be seen within utilizing and integrating DMT. So to start out, resource constraints and logistical challenges. According to Brow, Carolina, and others, in their article, they acknowledge that a lack of funding, inadequate space or facilities, and insufficient support from the healthcare organization itself would make it challenging to be able to utilize DMT effectively. And then also, another challenge with integrating it would be it's challenging to be able to apply this in existing traditional healthcare models and facilities, and then with the workflow that the staff already has, it's difficult to find staff that is able to implement this. Next, we have skepticism or lack of awareness. This comes from lack of awareness about the benefits and efficiency that DMT specifically has to offer. This is mainly patients and patients' families. They don't know about the benefits of it and what it can actually do, so they don't want to give it a chance. This can also be seen in medical facilities since it's new to them, since it's a newer type of therapy. They may feel nervous or anxious about implementing it and implementing it correctly so that it benefits the patients. But having a lack of awareness on this, it could potentially hinder the widespread implementation of DMT itself. In order to address this, it's important that we explain the positive impacts on the various populations and the outcomes that it has had for patients on specific cases like we talked about in a previous video. Next up, we have methodological limitations in the research. This comes from possible biases from DMT therapists and clinical referrals, which are also seen in previous case studies. And then it's also a limitation because therapists don't know exactly what component of DMT makes it successful. They know that it does help the patient, but they have yet to finger and pinpoint what exactly is helping with DMT. Potential safety concerns or contraindications. This comes from concern about safety issues for certain patient populations. So maybe someone who is hospitalized and in the bed that can't move, they can still do DMT, they can still do the dance movement therapy, but it will look different for every different where it's taking place. So what facility it's being utilized in, that's going to look different for every type of patient, but it is still able to be performed. So in order to address the potential safety concerns that it has for not only the patients, it's important that there's proper training, supervision, and tailoring to individual patient needs if that is necessary. Okay, next slide. While the integration of dance movement therapy into healthcare settings holds immense potential, it is essential to acknowledge and address the various challenges that may arise. So it's important that we understand what limitations and obstacles we are facing rather than just saying, we're going to do this. All right, possible solutions for this. So it's important to build awareness and promote evidence-based practice. This can increase credibility among healthcare professionals, which will help with resource constraints and logistical challenges. Next up is fostering interdisciplinary collaboration and providing proper training. And then, so this one would help with skepticism and lack of awareness. So being able to foster it and provide the proper training for it would help with that. Next, we have adapting DMT to the contextual setting. This also kind of goes with This more goes with potential safety concerns, but also it also goes with skepticism and lack of awareness. So, and then we have seeking creative solutions to address resource constraints and emphasizing the alignment of DMT with patient-centered holistic care and involving caregivers. So all of these things can help with facilitating effective implementation of it. And then, for example, seeking creative solutions to address resource constraints. This can come from funding opportunities and utilizing existing facilities, which will help overcome financial barriers, which will make DMT be able to be implemented in different healthcare facilities and be seen more. Finally, ongoing evaluation, open communication, and a commitment to continuous improvement will be crucial in addressing emerging challenges and refining DMT implementation strategies for optimal outcomes. So basically, acknowledging all of these obstacles and limitations that there are, it is important that we do that, because if we don't, we'll never be able to find possible solutions and how we can refine DMT to be able to implement that successfully within the healthcare world.